The very first video on this YouTube channel covered how Medicare works with VA coverage, and it was 3.5 years ago. I'm pretty embarrassed about it as I watched it again before this video, not just because of the haircut that I was sporting at the time, but my on-camera awkwardness was pretty epic. So here's an update to that video on the decisions that you need to face if you have VA coverage once you become eligible for Medicare. And the most common question that I get from veterans who have VA coverage is, do I have to take Medicare at all? And the quick and easy answer is no, you do not have to, but there are some things that you may want to consider before you make that decision. And the first question I have back to you is, how do you feel about VA healthcare in general? I have two uncles who are veterans, and then they both have VA coverage. One of them absolutely loves it, and he seeks care there anytime he has any sort of healthcare needs. The other can't stand it for his own reasons, and he wants to go anywhere else for medical services. Your feelings about your VA care will impact your decision as well as the priority group that you fall into. And here's how. There are 3 general feelings that people have about this decision, and I'll cover each in order. Those who know without any doubt that they will only use VA facilities for healthcare for the rest of their lives. They have zero interest in anything but VA care. The second are those who are fine with VA care, but they aren't sure, and they would at least like some sort of an option around visiting non-VA providers. And the third are those who know that they will be seeking care outside VA providers and facilities. They are not fans of VA healthcare. So let's start with those of you who know for a fact that you will only seek care at VA facilities for the rest of your life. Your decision is relatively simple. Just stick with your VA benefits. If your coverages there provide you with everything that you want and you need. You don't need Medicare because Medicare doesn't help you with any care that you are getting through VA. It won't hurt you to have Medicare Part A because there's no cost to having Part A if you do have enough work credits, but paying for Medicare Part B when you'll never use providers or facilities that take it is probably a waste of your money. Now, I need to clarify something. Back in 2014, the VA Choice Act was put into place, allowing eligible veterans to access non-VA facilities if a VA appointment was not available within a certain time frame, usually 30 days, or if you live a significant distance from a VA facility. This act was later expanded in 2018 under the VA Mission Act into the Veterans Community Care Program. This opens up healthcare for veterans from providers in your local community who are outside of VA, but this really only applies when VA cannot provide the care that you need. This is paid for by the VA based on certain conditions and eligibility requirements, and you need VA authorization before you can receive care from any of these community providers. But the point is, when I refer to people who only plan on using VA healthcare or these community care options, that is different from somebody who, for example, lives near VA facilities. They have conditions that the VA can treat, and then they decide, no, you know what, I want to go try a specialist provider at a civilian facility. I just know that if I don't mention these community care programs, I'll have the comment warriors light up the comment section about how I'm misleading people. But to summarize your decision here, if you know without a shadow of a doubt that you'll be using VA care for the rest of your life and you don't want anything else, you do not have to sign up for Medicare at all, or you can sign up for Part A only since it doesn't cost you anything. However, the official VA stance on whether or not you should get Medicare is that they strongly encourage that you get Medicare for a few reasons, like potential changes to VA funding, which I will get to here in a minute. Now let's move on to the group of people who are okay using VA care for the rest of their lives, but you'd at least like the option to visit non-VA providers if you wanted to. You have a couple of options available to you, but the most common route that we see people take are a type of Medicare Advantage plan built specifically for veterans. You would need to take Medicare Parts A and B, which means that you would need to pay the Part B premium every month. As of the making of this video, that starts at $185 a month, and then it goes up if you have higher incomes. Many of these Advantage plans built for veterans have some form of a Part B reduction aspect to them, where the Advantage plan will pay back a certain amount back to you to lower your Part B premium amount. Now, some plans are a few dollars a month, others are nearly the entire Part B premium amount. So this will all depend on where you live and what plans are available to you. These plans also come with some form of dental, vision, hearing benefits, and if you aren't using the VA for these things, or you don't have coverages through the VA based on your priority group, now you at least have something. Even some people who know that they will never use non-VA providers will still go this route as well, because especially if they have those high dollar Part B reduction plans available to them in their area, because they could possibly get other perks that they would want to use, like gym memberships or over-the-counter allowances that are worth more than it costs for them to pay the Part B premiums, especially if there's the Part B reduction aspect to those plans. But if you wouldn't use a gym membership, or the benefits of these plans are not worth more than what you're paying for Part B, you do not need to get one of these. If you do go this route, you can still get all of the care that you are eligible for from VA facilities, while at least having something there in the event that you want to visit non-VA providers. These Advantage plans will have their own network of doctors and hospitals that you need to work within that will give you access to non-VA care without needing to spend a lot of money each month just to have the plan, even if you never use it. Another option is to get a Medicare supplement plan, but in my opinion, in most cases, this is a waste of your money if you are in this mindset of planning on VA care. It's just a cost decision here. For a supplement plan, you would need to pay at least the $185 per month to have Medicare Part B in place, and then the supplement plans do not have a Part B reduction program like the Advantage plans do. And then you're paying an additional monthly premium just to have the supplement plan, whether you use it or not. And these premiums range from, say, $65 a month for a high deductible Plan G, which is a type of supplement plan, up to over $300 per month on a regular Plan G, which is another type of supplement plan, and anywhere in between those cost ranges, because these rates are dependent upon where you live and usually your age. And then you're paying money for coverage that you aren't planning to use. So in my opinion, and from what we've seen from countless others in this mindset, supplement plans aren't really a great option here. A supplement plan can make sense in the next persona that we'll talk about, but not in this one where you plan to use the VA, but you'd at least like some contingency option of non-VA care. So to summarize, the most common choice for you in this group, you can keep your VA coverage, and then if you live in an area with a solid Advantage plan built for this situation, sign up for Medicare Parts A and B, and then look for this type of Advantage plan. Again, look for one with a good Part B reduction aspect to it, and then the other benefits that you would want and use, like gym memberships or dollars that you can use for over-the-counter items. The last persona to cover here would be those of you who know without a shadow of a doubt that you will absolutely be seeking care outside of VA facilities. If this is the case, then signing up for Medicare is something that you will want to do, and you will follow the same decision-making process that everyone gets to follow, which is signing up for Medicare Parts A and B, paying for Part B, and then most people choose between a Medicare supplement plan and a Medicare Advantage plan. And that conversation is an entire video in and of itself that looks like this. This is where supplement plans start to make more sense if you can afford them, because they give you the most access to providers across the entire country, and they are easy to work with. Again, watch this video for more on the differences between the Advantage plans and the supplement plans. I'll link to this video again at the end because there's a little bit more to cover here in this video. Okay, so far the conversation has been around how you feel about care through the VA. I've also touched on your priority levels, and those will influence this decision as well. But now I'm going to shift back to the VA's official stance on whether or not you should get Medicare. And again, VA encourages you to get Medicare for a few reasons. First, as we've mentioned earlier, VA funding for healthcare can change, and it has changed in the past. VA healthcare is funded by Congress, but it is not a mandatory program like Medicare. So funding levels are subject to annual changes based on the congressional appropriations. The PACT Act and the Veterans Choice and VA Mission Acts that I mentioned earlier all expanded VA coverage. But there is a possibility that these benefits could be reduced. I don't know how likely it is, but it is a possibility. And then changes in demand for VA services also factor into VA funding as well. So because of this idea that VA funding could change in a negative way for you, the VA encourages you to sign up for every healthcare benefit that you're eligible for so that you at least have options if you need them. Because if you delay signing up for Medicare Part B past when you are eligible for it, there could be a Medicare Part B penalty waiting for you. This penalty gets bigger the longer that you delay signing up, meaning it is a 10% per year penalty if you do not sign up for Part B when you should, if you were not covered by a company plan through your employer or your spouse's employer. Now, I need to clarify this because some get confused. Let's say that I'm 65 years old. I am no longer working for a company that provides me with healthcare coverage. That's important. But I have VA benefits, and I decide that I'm not going to get Medicare. I'm not going to experience any penalties at this point in time. Let's say that I go 5 years down the road, so now I'm 70 years old. I still have not experienced any Medicare penalties at this point. But then I decide that I want to visit a surgeon outside the VA because he or she worked on Tiger Woods, and I want that same person who happens to participate with Medicare. Well, I could go and pay that surgeon their cash rate, which is likely very high, or I would need to sign up for Medicare Part B now at 70 years old. That's 5 years of time of me not having Medicare Part B when I should have. That would be a 10% times 5 years, so a 50% Medicare Part B penalty that lasts as long as I continue to have Part B in place. So that's how the Part B penalty works. It goes into effect if you do decide in the future that you want to pick up Part B after your initial eligibility for Medicare. You're not going to get penalized if you never take Medicare Part B. Only if you decide to sign up for it later. Okay, Medicare Part D, which is drug coverage, is also a reason that the VA cites as to why you should consider getting Medicare. Now, Part D carries a penalty for those who don't have creditable drug coverage when they should be on Medicare. However, VA drug coverage is considered creditable, meaning you won't have the Part D penalties should you decide to pick up Part D later. However, if you want to get medicine from non-VA doctors and fill your prescriptions at your local pharmacy instead of through the VA pharmacy or mail order service, you would need a Medicare Part D drug plan on top of your VA coverage. Finally, finances in a little bit more detail are a part of this conversation and decision for you. Taking Medicare costs money. Even with those Advantage plans that have the Part B buyback program, they're still going to be out-of-pocket dollars most likely for you. If you want to go full Medicare and then you want a supplement plan, it costs even more money out of your pocket every single month. So can you afford the extra costs? And if you can, is it worth the ability to seek care outside the VA? I can't make that decision for you, and how you feel about it will be different than how somebody else in your position feels about it, and that's okay. That's why we see people who make all three of these decisions based on what we've discussed and their mindset. Now, independent brokers like us can't really help you on the VA benefits side of things. VA benefit support is all through the VA. I cannot intervene in your VA healthcare on your behalf. Your coverage options and your specific benefit assignments aren't something that we can help with. So I love hearing from everybody, but if you have VA-specific questions, I'm not your guy. If you fall into the camp of the people wanting to look at the Advantage plans built for veterans or Medicare supplement plans and drug plans, if you don't want to access the VA healthcare system, that's where we can come in and then we can add value to your life around these decisions, all at no cost to you. So if these types of plans are something that you are considering, you can reach me at theretirementnerds.com. I've linked to that in the description of this video. I'm not licensed for all 50 states, but I have partners who are licensed and familiar with whatever state you may live in. That doesn't mean that they live in your state, but they are licensed and familiar with all 50 states. Now, I leave a secret code word at the end of most of my videos to help me with comment management. If you leave a reference to a tiger after my Tiger Woods reference in the comments, then I will know that you've made it this far and I can take those comments a little bit more seriously. As promised, here is the video to the Advantage versus Supplement really decision-making process. You can just click right there and go straight to that video. I will see you over there.